How about the appetite of the patient?
Hello, Doc. Kuan, Doc.
Is it good
Dili ko din
appetite?
nakaon, Doc. Like, 3 spoons lang, Doc. Tapos,
Yes.
tigdalay na nabubusog sa gid.
So during this time, when the patient was brought to community health center, was she admitted?
Yes, Doc. She was admitted and diagnosed with gastric ulcer, Doc.
Okay. So no other medication or therapy were given. You should kuan yun din he. Kasi di ka na given unrecalled medication. Tapos magbutang ka din, no other medication or therapy was given.
Okay.
May workup ba? Were ultrasound done during this time?
Anya kan la, Doc, laboratory.
Mm-hmm. So,
Yes,
pwede
Doc.
naman po laboratory was done, but bagahin po ang gihapon. Undisclosed gihapon ang mga results. Were they aware of the result of the laboratory test?
Yes, Doc. They are aware, Doc.
Ano man po ang result ng laboratory test?
Anya kan and brother, Doc, gastric ulcer. Tapos siya nagbutang gyud kami unrecalled workup. Kaya may dapat ko naging papakuan unta pero waray na lahira nag waray na lang waray na lang po hira nagpa waray na lang naging sunod niya kanit doktor.
Oh, so ano nga workup ang yung papahimo niya ha?
I don't know, Doc, feeling ko an ultrasound pero waray ada mga sugod.
So,
Yes,
because
imaging test,
magkuang
Doc.
kadidihin no other medication or therapy were given, parang that is already what was given by the doctor. So meaning wala yatagin other medication or therapy. But if the doctor requested for them to have ultrasound done and they refuse, so that would be another case. Parang patient was advised for ultrasound, but due to paray man dila ultrasound na community health center, di ba? So,
Yes, Doc, waray, Doc.
advice for ultrasound, but due to financial constraint was unable to comply. Pero ito nga nung other medication and therapy were given, tanggal ito niya, ha?
Okay, Doc. Okay, Doc.
So, next slide.
Adi po, Doc.
So, how many days was the patient admitted?
In the community, Doc.
Oo.
3 lang, Doc. 2, Doc. 2 days lang, Doc.
So, why wasn't it part of your history? Will you put it in your past medical?
Waray na lang po ako nagbutangin ko, Doc, like na-discharge siya after.
Kasi, importante yan. Because you will have
Sige.
to give us, if your patient was doing well, and it recurred. So, parang nahanging kami because the patient was admitted. So, ngani 2 weeks. 2 weeks siya. At how many days of the symptoms was the patient admitted? Can you please go back on the previous slide? So, 2 weeks. So, during the 2 weeks, na-admit niya dayon?
Doc, after po ito na 2 weeks, Doc.
What do you mean?
Like, after ang pagka-admit niya, Doc, 3 days at the hospital, Doc, or 2 days?
No, I'm asking you, at how many days did the patient experience abdominal pain na na-admit niya?
3 days, Doc.
So, one week and 3 days.
1 week and 3 days. 1 week and 4 days, Doc.
4 days prior to admission. So, the patient was admitted at community health center. So the patient, nagbalik So the patient was admitted and diagnosed with gastric ulcer and was given unrecalled medication. Tapos the patient stayed at the and was discharged after 3 days with home medication. So sugad na lang ito. Kasi, parang ani mo kasi history, nagduduro-diretso ka. if we will not be asking you, parang aniya 1 week prior, nakadalagi hapon yung hospital, di ba?
Yes, Doc.
Oh, so
Sunod ko, Doc.
for other groups, parang amo bagi hapon iyo pag kita. Is it also the same? Parang continuously admitted hiya hospital. Oh, so parang if you say discharge, was it improved, unimproved? They sige. The next slide.
Ano pa po, Doc?
One
Next slide.
day, recurrence na hiya.
Yes, Doc. Recurrent.
Oh, there was recurrence of the epigastric pain, persistent in character,
Yes, Doc.
with a pain scale of 8/10.
Yes, Doc. May
This was a
improvement at
duration
iyo.
with mild body fatigue and constipation with dark tarry stool. Kaya constipation tas mushy inconsistency.
May dynamic edit unta dito, Doc. Like bloody dark tally.
Anong bloody?
Bloody dark tally.
Kaya kung dark tarry nga ni maitom.
Maitom, yes, Doc.
Kung
May
bloody
diarrhea
nga ni, may the red.
Yes, Doc. Nalipat na po, Doc.
So,
Sorry, Doc.
okay. It constipated nga ni, meaning matigat iya stool.
Matigat na,
Mushy
yes,
nga
Doc.
ni, meaning mahumok iya
Mahumok.
stools. So, how many times did the patient pass out dark tarry stools?
Amo tak dire na kondok dire na sure kay nagyakan niya 3 or 4. So, tapos dire ang patient ni kasi Doc dire na baton kung papakainan mismo. So
Okay.
nagkuha na talaga kami habantay, Doc.
Mhm.
Na brother la talaga.
What is the age of the brother?
Kuan, Doc, 27. Hello, Doc.
Okay, sige.
Yes, Doc.
Okay, let's proceed. So, ako malagtan aton comment regarding your HPI if your patient was admitted. Since it's
Yes,
the part of your history, it should be in your HPI. Dire at past medical because may da kasi the other group also put in the past medical. Sige, proceed. Can you crawl at 4 months?
Ano po, Doc?
Na-crawl na yan 4 months? With your hands and feet? Or with your hands and legs?
Adi po ang next reporter, Doc, kay hiyapot nag-input. So, maternal birth and neonatal history. So in gross motor, crawls at 4 months, at alone at 9 months, walks at 15 months. At present, able to walk, run, and jump with no motor deficit at all.
But,
Hindi,
excuse me, who was the hitong ini nga iyo developmental history? And brother?
yes, Doc.
During that time, what was the age of the brother? When the patient was at 4 months? So, 27 years old, ani mo brother. Ani mo patient,
Yes po.
what is the age now? Huh?
The age of the patient is 14 po, yun na, Doc.
27. So 13 years old. Ani mo brother during the time.
Yes po, Doc.
I haven't seen a baby crawl at 4 months. Pwede at kami crawl. Pero ang crawl ko talaga nga legs and feet. Parang usually at 7 months yan eh.
Kung po kasi, according po niya, brother, ang pati ayakan.
So also, since not unless 13 years old po ang nabud talaga hiya,
Opo.
matured. No na at itong brain na mature at 21 years old. So during that time, 13 years old, was he the one taking care of the child?
Po, Doc.
Was he the one taking care of the child?
Yes po, Doc. Because
Was what?
uh, he is the eldest po in their siblings po, Doc.
Okay. Okay. Sige, let's proceed.
So in fine motor, reach and pulled objects at 7 months and at present can,
Excuse me. Before nga kita mag-proceed, your patient is already 14 years old, di ba? And
yes po,
I don't
Doc.
think the mother or the brother were able to recall ang time na niya mga developmental milestone. So if you have already an adolescent and maring a deficit, you can put there at par with age. Haakon laha. Oo.
Oh,
At
okay
par
po,
with
Doc.
age, yeah. So what can your patient do now? No need to give us the developmental milestone, not unless you have a developmentally developmentally challenged na child. Okay? So you can give us what can your patient do now?
Yes po, Doc.
Okay. Sige.
Po.
Kung ano mo bata, siyahan, you will reach the developmental milestone if your child, siyahan kung may developmentally kung niya, intellectual disability or developmental delay, kasi katulo, if your patient is, kung makare-recall yahan mother, 5 years old below, pwede mo na 2 years old below. Ha?
Opo.
Pero other than that, if your patient has no developmental delay, you can put it there na at par with age siya. Tapos you can give me what can your patient do now? If your parents or kung will be able to and they cannot recall ba? Sige.
Noted po, Doc. Ma-proceed na lang po, Doc.
Oo, proceed.
So, kuan po, Doc, before admission, ano po, Doc, yung kakao nit breakfast is rice, egg, hotdog, and 1 cup of milk. Hit lunch naman po, Doc, rice, chicken, or fish, and vegetable. And in her dinner is rice, fish, and vegetable. So, kuan po, Doc, during admission na po, Doc, nagkasakit na po iya. So, iya breakfast po, Doc, bagat nag-iba niyan kuan, diet. So, naging rice, egg, and 1 cup of milk na la. Ngan hit lunch po, Doc, is rice, fish, ngan fruits. And her dinner po, Doc, is rice, fish, and vegetable.
So what do you call this kuan in your before admission nga diet? This is your 24-hour diet recall. An imo didi during admission, that is your immediate diet recall, ha?
Yes po,
Para
Doc.
mag-put
Noted
ka
po.
din caption. 24-hour diet recall is the usual diet of the patient prior to admission or prior to sickness. And the immediate diet recall is the diet of the patient during the time that the patient has sickness or was admitted, ha?
Okay po, Doc. Ano po, Doc, anton kuan, Doc? During na po. Sorry. Nag-chopping.
Immediate diet recall.
Okay po, Doc. Noted. Thank
Can you
you.
hear me? Sorry kay
Doc,
I do not
excuse
know
me
what
po, Doc. Medyo maluya po, Doc.
tamon internet ada. Sorry.
Okay la po, Doc.
Ha?
Doc, I shall proceed po, Doc.
Okay, proceed.
So, for our past medical history, the patient had complete childhood immunization. So, unrecalled type and date of vaccines.
No known allergies to food and in any medications. Patient's blood type is BRH positive with
Anong 7 bags of blood transfusion? What do you mean?
one po, Doc. Uh, Typo la po, Doc.
Sige.
So the patient had never experienced chickenpox, mumps, measles during his or her childhood. Never had any surgical history and any accident. No intake of any medication. So personal and social history. The patient is currently in grade 9 at Hinunangan National High School. She lives with 4 other members of her family in a well-ventilated concrete house. They have dogs and cats as pets at their home. Mosquitoes, flies, and rats are seen sometimes. Their toilet is a manual flushing type located inside the house. So Soleco is their electric provider and their source of drinking water, and for bathing and washing their dishes is spring water. They cook inside and outside the house using a firewood and gas stove, and if there usually food on the table. They eat a day usually with rice, vegetables, and fish. Her brother cooks their food, but sometimes they buy food outside. So the patient drinks milk every morning. Sometimes she drinks cola and consumes 3 liters of water a day. The patient wakes up at 6 a.m. every day to prepare for school and sleeps at around 8 p.m. During weekends, the patient usually stays at their house. During Sundays, they actively participate in their church activities. The patient doesn't have any dental visit history. They have a barangay health center in their place that they usually consult whenever experiencing any medical conditions. In their community, tuberculosis, dengue, smokers, and schistosomia were the known communicable and community disease. So for the family history, the patient's father is a 45 years old, high school graduate, and profession is a farmer and was diagnosed with anemia. So the patient's mother is 42 years old, also a high school graduate and a housewife, known hypertensive. So the patient has 3 other siblings. So the first sibling is 27 years of age, male, and his known medical condition is cough. And the patient took Lagundi and vitamins every day. So the second sibling is a 23-year-old female and is apparently healthy. And the third sibling is a 17-year-old female who is also apparently healthy. So the risk factors are tuberculosis, presence of rats, mosquitoes, and flies in the surroundings, cystomiasis, dengue, and spring water. So the head's assessment, she's living with 4 other members of the family with a good relationship with one another, but sometimes his mother does disciplinary action by pinching. Currently studying at Hinanangan National High School, grade 9 student, Filipino as her favorite subject, has a good relationship with her teachers and classmates. She spends weekends at their house watching TV and reading books. No history of alcohol and drug use. No suicidal attempts, no history of sexual activity, and she feels safe and protected at their home. So for the review of systems, for the general,
Were there any history of bathing in the river or wading in the during floody times. Ano mo pasyente? Do they also, the patient also go to the farm?
Yes po, Doc. The patient sometimes bath in
Okay, if
no,
you want to
no,
establish your diagnosis, especially if what you think is your diagnosis, you have to put it in your history. Yeah, the patient is fond of going to the river, bathing the river, going to the farm, to his father. So it can be also incorporated in your history. Okay?
noted po, Doc.
Sige.
So for the general, usual weight of the patient is 35 kilogram. Uh, she has recent weight loss, weakness, and fatigue, but no signs of fever. For the skin, uh, no rashes, no lumps, no sores, no itching, no dryness, no changes in hair or nails, and no changes in size or color of bones. For the head, eyes, ears, nose, throat. For the head, no headaches, no dizziness, head injury, or lightheadedness. For the eyes, no glass or contact lens, pain, redness, excessive tearing, no double blurred vision, no spots, no specks, no flashing lights, glaucoma, no cataracts. Patient never went to an ophthalmologist for eye examination. For the ears, no tinnitus, no vertigo, no earaches, no infection, no discharge, no use of hearing aids. For the nose and sinuses, no frequent colds, no nasal stuffiness, discharge, itching, hay fever, nosebleed, sinus trouble. For the throat, no dry mouth and bleeding gums, no dentures, no sore tongue, no frequent sore throats, no hoarseness. Patient never went to dental clinic for dental examination. For the neck, no goiter, lumps, neck pain, no stiffness. For the respiratory, no productive cough, no sputum color and quantity, hemoptysis, dyspnea, no wheezing, no pleurisy, no asthma, bronchitis, emphysema, no pneumonia, and no tuberculosis. So last chest x-ray, two x-ray was conducted in Katbalogan. Results are unrecalled.
At Balonga is in summer. Ano yung pasyente ka din? Hinunangan, nangati at ano yan na x-ray?
Ay, Dok, sorry, Dok. Ay, autocorrect kasi, Dok. Ano kung keypad na ako niya, Dok. It mga lugar na lilipat.
So, you have to check, ha?
Opo,
Kasi
sorry, Dok.
summer yan, hinunangan, ati didi. Sige.
Anak dita na akong keypad, Dok. Nakukuha nit lugar na automatic ya, Dok. Bagay at bag, Dok. Kanan.
Dahil sa mga auto type ba yan, dami ito ng bubulag.
Opo, Dok.
Sige, proceed.
Sorry, Dok. For the cardiovascular, no edema, rheumatic fever, heart murmurs, chest pain or discomfort, no palpitations, no dyspnea, no orthopnea, and paroxysmal nocturnia dyspnea. For the gastrointestinal, no loss of appetite, has nausea, positive in bowel movements, changes in bowel movements, and constipation, no pain with defecation, no trouble swallowing, uh, positive for heartburn, black or tarry stools, no hemorrhoids, no diarrhea, positive for abdominal pain in the epigastric area, negative for food intolerance, and negative for excessive belching or passing of gas. Patient's stool color is brown, approximately 10 ml or bowel movement per bowel movement. For the peripheral vascular, no leg swelling, no leg cramps, varicose veins, no past clots in the veins, no color change in fingertips or toes during cold weather. For the urina, frequency of urination, 8 times per 24 hours, 60 ml per urination, no polyuria, no nocturia, no urgency, no burning of pain during urination, no hematuria, no UTI, no flank pain, no kidney stones, urethral colic, no suprapubic pain, no incontinence. For the genital, no itching, no sores, no lumps. For the musculoskeletal, no muscle pain, no backache, no stiffness, no arthritis, no gout. For the psychiatric, no nervousness, no tension, no mood, no depression, no memory change, no suicide attempts. For the neurologic, no headache, no dizziness, blackouts and weakness, no changes in mood, attention or speech, no changes in orientation, memory, insight or judgment, no vertigo, fainting, paralysis, no numbness or loss of sensation, no tingling, no tremors, and no other involuntary movements and no seizures. For the hematologic, the patient is anemic, no easy bruising, no easy bleeding, and positive for past transfusion. For the endocrine, no heat or cold tolerance, no excessive sweating, no excessive thirst or hunger, no polyuria, no change in glove or shoe size. So for the physical exam, for the general appearance, patient was examined lying, conscious, alert, and coherent, oriented to time, place, and person, well developed and well groomed. For the vital signs, blood pressure is 110 over 70. The temperature is 37.6 to 36.7 Celsius. Pulse rate is 105 beats per minute, and this respiratory rate is 15 breaths per minute. So for the skin
BMI
is
mo,
warm.
your BMI. Do you have BMI?
Waray pa yung kaputang to. Wait lang. Doc, sorry, Doc, excuse me. 14.6, Doc.
Okay, so can you interpret your BMI?
So she is considered underweight po, Doc. So for the, shall I proceed po, Doc?
Yes, proceed.
For the skin, Doc, the skin is warm, fair complexion with good skin turgor, negative for petechiae, ecchymosis, no rashes, no active lesions, no hypopigmentation, no cyanosis, no jaundice and edema, nails are pink in color, capillary refill in 2 seconds, no clubbing. So, Doc, for our anthropometric measurement, so, Doc, adding in a BMI of 14 point kanini, Doc, napanlaya. So, for the head circumference, measurement is 50 centimeter. So, for the chest is 41, abdominal circumference is 35, the muwak is 21, the height is 139, 35 kilogram. For the head, skull is symmetric with no masses. Temples are not depressed. Hair is black in color, fine, straight, and equally distributed. So for the eyes, eyebrows are symmetrical, eyelashes are fine, oriented outwards, clear cornea, pupils are equally round and reactive to light, EOM and visual fields are intact, no nystagmus. For the ears are symmetrical, aligned from pinnae, intact tympanic membranes and canals, and have good hearing acuity. Nose and sinuses, pale mucous membrane, septum is symmetrical, and for the mouth and throat, complete set of teeth, alveoli at the midline, tonsils are not enlarged, pale, soft and hard palate. For the neck, trachea is symmetrical, thyroid gland is palpable and moves with deglutition. For the breast, no tenderness of both breast. And for the chest and lungs, thorax and chest expansion is symmetrical, unimpaired tactile phremetos in all lung fields, and resonant in all lung fields of both anterior and posterior chest upon percussion. For the heart, PMI at the fifth ICS left midline, upon was audible, no murmur, heart rate synchronous with pulse rate of 105 beats per minute. So S2 is louder than the S1 at the base, S1 is louder than S2 at the apex. No prolapsed abdomen, positive for rebound tenderness in the epigastric area, liver palpable, spleen and kidneys are not palpable. So we
But your
what I
abdominal circumference is 35
the patient refused doc.
Mm-hmm. But did you able to palpate the liver?
What I po doc ay area na pa na
Sige.
limit is full range of motion and upper and right lower limbs. Pero doc anya left foot wari nam ka note kay painful daw na yakanit patient when being moved. So no so no abdominal deviation, kyphosis, no lordosis, no bulging across the length of the spine, no paravertebral tenderness, no masses, and no pain during kidney punch. So, DRE doc, wari tumugot pan patient doc. For the genital also doc, wari tumugot. I'll give doc to the next reporter po doc.
Hello, good morning, Doc. For neurology example, mental status, the patient is 40-year-old female, Filipino, was evaluated in a lying and sitting position, awake, alert, and aware of her surroundings. She follows commands well, is coherent, sensible in her speech, talks appropriate for her age, and cooperative. For her cranial nerves, cranial nerve 1. She has intact sense of smell for both nasal passages. Cranial nerve 2, 3, 4, and 6. Visual fields are normal in all quadrants. Pupils are round, briskly reactive to light with good accommodation. EOM are intact without ptosis or nystagmus. For cranial 5, facial sensation is intact, bilaterally to dull, sharp, and light touch stimuli. For cranial 7, facial muscle strength is normal and equal bilaterally. For cranial nerve 8, hearing is normal and bilateral. Cranial nerve 9 and 10, palate and uvula elevate symmetrically with impact gag reflex. Cranial nerve 11, shoulder shrug strong and equally bilateral. And for cranial nerve 12, tongue protrudes midline and moves symmetrically. Next slide. For the motor po, normal posture, symmetrical limb movements, normal tone with symmetrical muscle bulk. And for muscle tested po, elbow flexors and extensors, wrist flexors, extensors, finger abductors, adductors, flexors, and ankle dorsiflexion. For cerebellar po is unremarkable po. Nawala ako. Nawala ako. Meron ako ba? For sensory po, impact, light touch, pinprint, temperature, position, and vibration sense. For meningeal, unremarkable po, and autonomics, unremarkable.
For the salient features, Doc, for the demographics, 14 years old, female, Filipino, and grade 9 student, sorry. For the HPI, epigastric pain, nausea, vomiting, fatigability, history of gastric ulcer, heartburn, Daktari, diagnosed with anemia. For the physical examination, positive for rebound tenderness in the epigastric region.
Hi. Hello? Hello?
Hello?
Hello, Dale. Continue po for differential diagnosis. Our pivot po is upper abdominal pain, specifically po sa gastric area. So we have GERD, schistosomiasis, and IBD. For rule-in po sa GERD, patient had heartburn, abdominal pain, vomiting, and hematemesis. We ruled it out po because patient had no respiratory symptoms, chest pain, and GERD is most commonly peak at 4 months and resolves at 12 months. For schistosomiasis po, we rule it in because the patient has abdominal pain, hematemesis, and anemia. But she has no rash and difficulty in passing urine. For IBD po, we rule it in because the patient had weight loss, abdominal pain, and fatigue. We ruled it out because the patient had no diarrhea. For our primary impression po, the patient has upper gastrointestinal bleeding secondary to peptic ulcer disease. Thank you, Doc.
Okay. See, please take note lang mga comments that were given to you. So,
Okay, Doc. Thank you po.
let's proceed to the next group.
Thank you po, Doc.
To
And ako ang share screen. Thank you.
So, Doc, start na po, Doc.
Yes, you may start.
Oh, good morning po, Doc. Ako po ngayon, Marquette. Hallelujah. We are the subgroup 3. Next slide, please. So, general data. Patient JL is a 17-year-old Filipino male, Roman Catholic, lives in Barangay 8, Iporlos, Eastern Samar, and was born on June 21, 2005. At Eastern Visayas Medical Center, EMC, he was admitted to Eastern Visayas Medical Center twice. Date of interviews, February 2, 2023. Source of data
What do you
was the
mean
mother of the
twice?
patient. Oh,
What do you mean
twice.
twice?
Makaduha po yan na admit ha EVMC.
During this admission,
Dire po to. Dire during this admission. Ano ya mga
he was admitted previously.
yes po.
So, should it be incorporated in your general data?
Past medical.
It should be in the past medical. Wala na. So, it should be in the past medical, ha?
Yes po, Doc. Sorry.
Okay.
So, date of interview was February 2, 2023. Source of data was the mother of the patient. Reliability 60%.
Why only 60?
Source kay dire man mismo ang patient ang naka-istorya kundi ang mother.
Sige.
Tapos Dok, aniya data kasi bagat diri good sugad ka reliability.
Sige. Okay, let's go to your history.
Next slide, please. So, chief complaint, pain during urination. So, aniya gi-describe ni bagat tusok-tusok it kasakit. So, 4 days prior to their admission, the patient experienced pelvic pain during urination with a pain scale of 4/10 and used Vicks to lessen the pain. No other associated symptoms were noted. No other medication was given. The mother sought help and went to a folk healer or albulario, but was unable to be treated, and no consultation was done. 3 days prior to admission, the patient pelvic pain progressed during urination with a pain scale of 6/10 that occurs every 5 minutes with multiple occurrences and use hot compress to ease the pain with no other medication given.
Pelvic, dir hypogastric? Bukos good?
Bukod yes, Doc.
Sige.
Next slide, please. 2 days prior to admission, the patient is unable to urinate properly due to the intense pain. No medication was taken, no associated symptoms was noted. 1 day prior to admission, the patient's pelvic pain progresses with the pain scale of 10/10 and described it as tusok-tusok. And by this time, the pain cannot ease by topical and hot compress and no other medication was given. Therefore, the mother was prompted to bring his son to AVMC for consultation. Anila, Doc. On the day of the mission, he was directly admitted at Eastern Visayas Medical Center and was given gabapentin 3 times daily with unrecalled dosage. And there are no associated symptoms noted
Why
during
did
that
you
case.
put there the gabapentin and the kuan?
Kay aw mang dok dapat
Hmm?
direto dapat iupod kay
It's already the course in the ward, di ba? Direct
opo,
part of
oo,
your HPI.
opo, opo.
So, no fever, iningay mo pasyente.
No associated symptoms, doc, promise.
Mhm. Sige.
Next step is, so review of systems. So general, presence of weight loss and weakness, no fever and chills. Skin, no rashes,
Can you give us
pruritus.
the weight loss? How many percent was the weight
Doc,
loss?
um, kama, being honest la, doc, wala kami ito makapagkaya na talaga kung peran weight loss.
Kasi you have an acute patient. How many days pala? 4 days pala ni HPI.
Kay,
Usually, we experience mga weight loss and mga chronic like in previous nga group, di ba? Kuan, 2 weeks.
Yes, Dok. Magyaptanan amo na pa usahan kay an baton hananay haamon. Bagat amo daw kuno ito an iya bagat pagkasa tas yumakan kami nga bagat diri man sugad ba dapat kay dapat chronic kay an iya gingasaan kay super dako tapos nagpakiana kami han wait han before hiya ka ano
Admit.
ka admit diri gyud maaraman nanay tas nagin-describe la niya anak
So,
nga bagat
how
durod
can
ako
you
daw
compare it on weight loss? What will you do if you're going to ask if they do not know what is the actual weight?
anyabado po, Dok.
Pwede gihapon. Ano pa?
tapos an iya
Kuwan.
body koan
Oh, you can ask.
body build
Kunha piso, ma'am. Ano,
Mm.
katungayang piso, 3/4. Kasi, amo to yung pagkuhaning weight gihapon, ha? So
sige Dok.
hapiso.
Noted Dok.
Oo. Kung dire ko rin piso, sige, kuha na lang. 5 pesos. In a 5 peso coin. So, ano niya ginkuanan? Gasan. Katunga ba? 5 pesos? Banso ka dito.
Okay Dok,
Sige
noted.
po, Dok. Noted po, Dok. So skin, no rashes, no pruritus, lumps, sores, itching, no changes in the hair, nail size, and color of moles. Head, presence of lightheadedness with no head injury, lumps, or scars. Eyes, no pain, no excessive tearing, no blurred vision, no spot or no specks, no flashing lights, and no eye twitching. Ears, no tinnitus, no vertigo, no earaches, no infection, no discharge, and non-use of hearing aids. Nose and sinuses, no frequent colds, no nasal stuffiness, no discharge, no itching, no hay fever, no nosebleeds, and no sinus trouble. Throat, mouth, and pharynx, no bleeding gums, no dentures, no sore tongue, no dry mouth, no frequent sore throat, and hoarseness. Neck, no goiter, no lumps, no pain, and no stiffness. Breast, no lumps, no pain, and no nipple discharge. Respiratory, no cough, no hemoptysis, no dyspnea, no wheezing, no pleurisy, no asthma, no bronchitis, no emphysema, no pneumonia, and tuberculosis. Cardiovascular, no high blood pressure, no rheumatic fever, no heart murmur, no chest pain or discomfort, and no palpitations. Gastrointestinal, no trouble swallowing, no heartburn, no nausea, no change in bowel habits, no pain with defecation, no rectal bleeding or black or tarry stools, no hemorrhoids, no diarrhea, no abdominal pain, and no food intolerance. Stool color is firm yellow, has constipation, and has excessive belching or passing of gas. Urinary, patient reported of polyuria with and nocturia 7 times daily with approximately half cup per urination. No kidney stones, no flank pain, incontinence, suprapubic pain. Genital, no hernia, no discharge from or source on the penis, no testicular pain or masses, no scrotal pain or swelling, no history of STI and their treatments, and no sexual habits. Next slide, please. Musculoskeletal, no muscle stiffness, no arthritis, no gout, and no backache. There is muscle pain from the left side of the buttocks. Psychiatric, no nervousness, no tension, no mood, no depression, no memory, and no suicide attempts. Neurologic, no changes in mood, attention, or speech, no changes in orientation, no memory loss, no insight or judgment, presence of weakness, no headache, no dizziness, no vertigo, no fainting, no blackouts, no paralysis, but has numbness or loss of sensation on the left leg, has no tingling or pins and needles. The patient sometimes experiences tremors or on the upper extremities. No other involuntary movement and no seizures. Hematologic, the patient is anemic, no easy bruising, no easy bleeding, has fast transfusion but no transfusion reactions. Endocrine, no heat or cold intolerance, no excessive sweating, no polyuria, has excessive thirst, and has changing glove or shoe size.
So for the past medical history, the patient was admitted on December 16, 2022 due to bloody stool. The patient was unable to recall the medication taken during his admission. The patient became well and was able to go back to his home on December 31, 2022. Patient has a blood type O and has a history of fast transfusion during December 2022 5 times. No surgical history, no drug reactions, and allergies to food.
Were there any follow-up after the discharge?
Waray na po heradok bumalik.
Were they was the diagnosis known to the patient?
Diri po heradok maaram. Asya an reliability nakadiri.
Paano dire maaram kay
Mother.
yeah, they are being explained the diagnosis, mga steps, other intervention that should be done to the patient, mga advice nga kuan laboratory workup, alright?
Siguro dok from mother ada may neglect gihap kaya bagan waray hiya nag follow up na after had to. Tapos iya pa nakalimutan diri talaga iya nakakainom dumada.
So you don't know gihapon if the medication were compliant gihapon hira kay di nga nila maaram kuan.
Oo, Dok.
Diri talaga hiya.
See. When you do history, do not judge, ha? Ayaw ka mo pagyakanin. Kaya ma'am, waray ka muna follow up. Kaya no kuan, dapat suwid. Say it in a nice way, professional way, ha? Kaya you don't know gihapon kung ano reason, may daghapon to nila reason why they are unable to follow up, why they are unable to do mga laboratory workup. So, beware
Okay.
lang ito ton ato ni Gayakan, ha? Okay? Sige.
For the family history, the father is a 59-year-old male, no history of illness. The mother of 35 years old, no history of illness. With 2 siblings. 2 of his siblings has no history of illness. And the
Sorry, I
mother
cannot hear.
Hello po.
Louder, please.
asal. For the family history po, Doc, father is 59-year-old, no history of illness. A mother of a 35-year-old female, no history of illness. With two of his siblings has no history of illness and apparently well. For the mother side, may they had a diabetes. For the personal and social history, the patient's highest educational attainment was senior high. He studied at Giforlos National Trade School. The patient had no problems in schooling. Patient is the oldest child among his two siblings. Patient is living with his mother and father. Father is a tricycle driver working every day, and the patient is being looked after with his mother only. For the environmental history, patient lives with his parents in a one-story wooden house and well ventilated. The patient has a pet cat and there are no mosquitoes or other pets in their house. Their toilet is located inside their house and their electric supply is from Samelco. Their garbage is being taken every Thursday. The source for their drinking water is mineral water, while the water they use for washing is from their deep well. Their kitchen is inside their house and they use gas for cooking their food. The mother of the patient is the one who buys food and cooks their food. The patient usually eats rice, vegetables, and fish for breakfast, lunch, and dinner. So for the head's assessment, he does not fight with anyone in the household and to always play with his two younger siblings. As for education or employment, he is friendly. He has a lot of friends. He did not experience being bullied in school and his favorite subject is math. For the daily activities, during his spare time, he plays basketball with his friends. For the drugs, he drinks occasionally with his friends and smokes 2 to 3 sticks a day. For sexuality, he does not pressure himself to have intimate relationships. For suicidality, he is not depressed. He does not have any suicidal thought, no intention of hurting himself nor ending his life. For safety, he always feels safe and his mother's always there if he needs someone.
What do you think is his sexual preference?
Uh,
Female.
Female, yeah.
sure. Next na po daw.
Said.
For the birth and maternal history, the for prenatal, patient was born to a 35-year-old G1K3 mother at Eastern Visayas Medical Center. The mother had no history of illness, doesn't smoke, nor drink alcoholic beverages during the whole course of pregnancy. For the birth history, the patient was delivered full-term via vaginal delivery in a cephalic position in EVMC. Umbilical cord was cut using a sterilized medical apparatus. Umbilical pump was cleaned every day using cotton that was soaked in warm water.
Ana, excuse me. Ano mo, gravida 1 para 3?
Yes,
35-year-old during the time that the patient was delivered. So you should put the date or the age of the mother during the time of the delivery.
Ay, Dok, pag sugad ito nga prenatal, unaged talagahan mother.
Oo, kay prenatal ka, previous.
Okay, Dok.
Kung
Okay.
ano mo kanan history na family history, mabutang kanan imo an iya actual na weight and actual age and mother.
Okay
Kasi
po,
grabe
Dok.
the one para 3, what do you mean by that?
Tanan na po sir na born.
So grabe the 3 para
Yes,
3.
po, Dok.
But your
Yes, po,
patient
Dok.
is the eldest, so grabe the 1 para 1.
Okay po, Dok.
Grabe
Basta
na nga ni, meaning how many times did the mother get pregnant, ha? Para nga ni parity is how the age of the mother, the age of gestation that the don't reach han imo parity.
Yes po.
Usually at 24 weeks ba to and parity? So, ito. So, grabe the 1 para 1.
Okay, Dok. Thank you po. For the neonatal history, patient was cyanotic after delivery, nor had any skin discoloration, and a strong cry was noted after delivery. No dyspnea, no convulsion, no hemorrhage, and no known other
Don't start
complications.
with a negative negative Parang, parang sentence ba? Ano mo dapat dila ni mo ni neonatal? Patient noted to be pinkish with strong cry. Amo dapat. Hindi rin ka mabutangin patient was not cyanotic.
Okay, Doc.
Ha? So,
Okay
ayaw
po, Doc.
pag-start in negative.
Ah,
Na
okay.
word ito niyo mo sentence.
Okay po, Doc. No dyspnea, no convulsion, no hemorrhage, and no other complications were noted. First stool appears to be black, soft inconsistency without odor. For the development history, at the age of 17, in emotional social changes, he has more interest in romantic relationships and sexuality. Feels a lot of sadness or depression which can lead to poor grades in school, alcohol or drug use, and safe sex and other problems. Spend less time with parents and more time with friends. For thinking and learning, be able to give.
When you do your heads, do you do it with only the patient or was the mother around?
The mother was around po, Doc.
Ano?
The mother was around po.
Oo, kasi parang kung kasi yan eh, smoking, alcohol drinking, tapos
Po, Doc.
pwede gahapon kasi sexual kuan na. Your patient is already sexually active.
Ang parent po, Doc, mismo nang nakaka-istorya tapos napakyanan niya nanay sa patient na, ano, Doc, pero kapos kita ni mo na uubos.
Kasi kung ideally, if you do heads, di ba, it should be confidentiality. You should establish confidentiality with your patient. You can excuse ito ni mo mother if you want to do the heads only with the kuan. Kay there are some mga information that the patient will not be able to disclose to you because present and mother. So, you may not know nga patient is already sexually active.
Okay po, Doc. Nakadapan niya mga
Noted, Doc.
Oo. Kasi dapat talaga, you can excuse man, pwede ka sa maring mother nga, ma'am, may dala kasi kami igpapakiana nga kuan. But before you proceed with the heads, you should also consent, ask for the consent of the patient kung okay lang. So there are questions that I would ask, tapos you will start with mga open-ended question. Dire kay yes or no. Okay? Oo. Kasi usay gyapon ito ka lecture itong inyong heads. Training kami nga ni nag-training gihapon kami ito para leto nga heads. Kanan koan kanan to kanan heads. Sige.
noted po, Doc. Thank you. For thinking and learning, be better able to give reasons for their own choices, including about what is right or wrong, learn more, define, work hard. For the language, communicate like adults, however, they may not ask for clarification or speak up when they do not understand a word or the meaning of a phrase. They use slang words of before onset of illness. Di ba, Dok, mo yakan kanina may death tawagan 24-hour?
Yes. 24-hour diet. You use the 24-hour diet recall.
Yes, po, Doc. For the for breakfast, usually na-accumulate niya 970 kilocalories. Sa snacks, 400 kilocalories. Sa lunch, 698 kilocalories. And for dinner, 620 calories. A total of 2,689 kilocalories before onset of illness. So, unrecommended kilocalories ang iya age po is 2,440 kilocalories. So, sa kubiya ha, iya recommended. So, during onset of illness, for the breakfast, 261 kilocalories na laan iya nako-consume. For the snack, 243 kilocalories. Lunch, 263 kilocalories. For the dinner, 261 kilocalories. A total of 1,228 kilocalories. So medyo tiriya pasok sa iya recommended kilocalories for 17 years old na 2,440 kilocalories. For the immunization, as for the mother, kompleto man ang iya vaccine, yan ang immunization. So for the physical examination,
Yan did not
general
receive any mga booster dose, ano?
waray po, Dok. Kaya bagat hadto daw ko nga time, dili pa uso ang mga booster.
Ano daw? Kaya may rotavirus vaccine na kami. Are you sure? During that time?
17 years sa mga 2020.
Ha?
Waray pa dito, Dok.
Oo, waray pa. Waray pa kita
Recent age ito
rotavirus.
yung mga 2020,
Oo.
2015 pala dito, Dok.
Waray pa kita rotavirus at vaccine at during that time. Even the HIB was not part also of the immunization program. Because
Okay.
during that 9 months, measles pa talaga itong ginahatag. Dire itong MMR. Yan na lang ito nga may MMR.
Okay, cool.
Sige, proceed.
For the physical examination, general survey, the patient was examined lying on bed, conscious, alert, coherent, oriented to time, place, and person, cooperative, well-groomed, well-developed, and ectomorph. For the following vital signs, 120/70 millimeters mercury, 37 degrees Celsius, 60 beats per minute, and 20 beats per minute. The oxygen saturation of 95%. For the anthropometric, head circumference of 40.6 centimeters, chest circumference of 70 centimeters, abdominal circumference of 80 centimeters, MOAC of 15 centimeters. For the length, height, and weight, you were not able to check po, Dok. Ay, ang iya kasi tiil, bagat diri niya na sa stretch, kay, bagat diri niya namumove kay masakit. Tapos ang iya weight, Dok, bagat bedridden na siya kay, ang pagka nga ni namon ang iya, kasakit, 1,000 out of 10 na daw. So, wari talaga kami makakuha niya weight. For the BMI, wari kami, Dok, makaano, pero ideally, 21 dapat. With iya, at 17 years old. So here is BMI for age boys 5 to 19 years old. So for skin is warm with fair skin turgor, no ecchymosis, no active lesions, no hyper or hypopigmentation, no cyanosis, no rashes, and no edema. Nails are pink in color, capillary reveal in toes, and no clogging. The head, skull is atraumatic and symmetric, no masses, temples not depressed. Hair is black, straight, fine, equal in distribution. No alopecia, no lice infestation, no dandruff, no active lesions or tenderness. To the eyes, eyebrows are symmetric, no active lesions or scars. Eyelashes are fine, black and oriented outwards. No edema on the eyelid, no tenderness or blood. Anecteric sclera, no hemorrhage and ulceration on the sclera. Cornea is clear with no ulceration. Pupils equally round, reactive to light and accommodation. 3 mm in diameter and intact POS. For the ears, are symmetrical, aligned, formed, no tenderness, no lesions, intact tympanic membranes and canals, no impacted cerumen, no active lesions, and has good hearing acuity. Nose and sinuses, presence of nasal flaring, pink mucous membrane, septum at midline, no epistaxis, no lesions, no nasal discharge, and no congestion. For the mouth and throat, no cyanosis, no angular deviation, no fissures, no ulceration, bleeding or sores on the gingiva. Uvula at midline, tonsils are not enlarged, pale pink, soft, and hard palate. Complete set of teeth, no dental caries, and no sores on the tongue. For the neck, trachea is at midline, thyroid not palpable, moves with deglutition, no palpable lymph nodes, no lumps, no venous engorgement, no carotid brewing or visible pulsations. Breast, for the breast, no discoloration or dimpling, no discharges of both breasts, no palpable lymph nodes, no lumps, and no tenderness of both breasts. For the chest and lungs, thorax is symmetrical, no lesions, no masses, no lagging, no supraclavicular, no intercostal retractions, no tenderness, no symmetrical chest expansion, and no unimpaired nasal premitus in lung field. Anterior of lung fields are resonant, and no crackles, and no wheezing hurt. For the heart, no pericardial bulging, no thrills, no heaves, no lumps, and no tenderness. BMI was taken at 5th ICS. Heart rate was normal and was synchronous with pulse rate. No pericardial rubs and no carotid brewing heard. For the abdomen, flat abdomen, abdominal girth of 80 centimeter, no ascites visible peristalsis, pulsations, lumps, nodules, scars, soft to touch, liver not palpable, no tenderness, spleen is not palpable, tympanitic, with normoactive vowel sounds. For the extremities, symmetrical, symmetrical, equal in length and size, no edema on extremities, no deformities, no cyanosis, and presence of atrophy with no tenderness.
So for the neurologic examination, am I audible?
Yes,
Hello?
doctor.
Ah, for neurologic examination, dira ko nakita slide. So for the mental status examination, the patient is conscious, attentive, and cooperative, oriented to time, place, and person. Well groomed, speech is clear, thought process is intact, affected within normal, and responds appropriately. So for the cranial nerves of the patient has a sense of smell. In cranial nerve 2, the visual acuity is intact, visual fields are full, the pupillary reactions are normal. In cranial nerve 3, 4, and 6, the patient has a intact extraocular muscles, no ptosis, no nystagmus, and no limitations of eye movements. For the cranial nerve 5, normal tone of force in the muscles and mastication, intact sensation for light touch and temperature and pain with a presence of corneal reflex. Next. So for cranial nerve 7, the patient has asymmetric movement and strong muscles of facial expression. In cranial nerve 8, the patient was able to repeat words whispered to him and was able to localize the sound. For cranial nerve 9 and 10, the patient's uvula is in the midline. Uh, and then for the cranial nerve 11, the patient has muscle atrophy and uh, was present and there's no fasciculations. For cranial nerve 12, the patient has the tongue is in the midline, is able to protrude the tongue symmetrically. So next slide. So for the motor function, uh, the patient has a muscle strength on upper extremities with a grade 3, with a active movement against gravity with no resistance from the physicians, with a atrophic muscles on the lower extremities. So for the sensory, the patient has a sensation for pain, light touch, and temperature, both upper and lower extremities. And for the reflexes, the patient is negative with Bavinsky, Brudzinski sign, Kernig's, and nuclear rigidity. For the reflex, amo po ade an iya reflex. +1 la po ani ankle and plantar. Nakaka-movie ya, Doc, pero dire ko diya na nakakatok daw. pero namumove lang niya. So for cerebellar, the presence of tremors was noted hands with a autonomics, no bladder or bowel incontinence. So for the salient features, for the demographics, 17-year-old Filipino male, Roman Catholic, history with a pelvic pain, physical examination, weight loss and weakness, presence of lightheadedness, polyuria, nocturia, lump on the side
Why is
of
it in
his
your physical exam? Ano mo polyuria and nocturia? Maria, urinary incontinence, frequency. How do you
uh
describe polyuria?
and koan doc ay for the polyuria kasi doc, mas damo it na tapos
How many
frequent it
liters of urine should be in polyuria?
more more than 3 liters
More
doc.
than 3. So your patient was
Uh,
able to kuan 3 liters. There
um
urinary incontinence frequency.
um uh doc,
Hmm.
nagpakiana kami iniha iya sa kanya dire man daw.
Ano? Pardon?
Nagpakiana kami iniha iya. At
Mm-hmm.
urinary incontinence doc, diba doc it bagat dire niya nako control it iya pag ihi like hello doc.
Ah,
Hello doc.
sige, sige. Okay. So incontinence.
An anya
Mm-hmm.
nagpakiana kami niya iya waray doc. Kuan man niya daw dok. Wala man daw ko na niya urinary incontinence. Pero
Frequency.
aniya frequency dok, nag-iihi talaga siya.
Mm-hmm. Bangin urinary frequency ka lang.
Kadamod tudok yan na nag-iidok.
Pero tagdaramo gud iya giniihi.
Oh, diri dok damo. So diri di ba dok
Oo,
polyuria?
diri ya polyuria.
So
Siyempre, pagka kayo if you are thinking of polyuria, you are going to the Indocide.
oo,
Most common ito dito, DM type 1.
yes dok.
Mm-hmm.
So dok, it amon igbubutang nga di is frequency of urination
Oo,
nala.
urinary
Okay.
frequency. Butang
Ah,
kayo dito.
dire pala. Magyapinidok an akon pakiana kaana akon self kay dire man dako an iya
Diri
gini
damot iya
iili.
kasi iton
Frequency lang.
I've seen na type 1 talaga nga diabetes. Baga usala ka ihi na dehydrate talaga hira kay damuan. They are usually mga dehydrated nga mga bata. Bisan ano nimo kadamo nga how many kuan na in ito nga ni nga nag di ba thirst excessive thirst kaya kay every time na ihi nadi-dehydrate. Ito type 1 talaga nga diabetes. So bangin urinary frequency lahiya.
Frequency la dok, sorry.
Oo. So it's okay.
Amo
Kay
tanong.
you will learn along the way. We don't need you to be 100% man accurate with your history. That's why you have nga hininga ko an.
Magyapin yan akon pakiana dok hen na input ak. Kay dire kasi dako. So
So
dire pala
you have to check also if you are using the medical term, check also
Yes,
anong
dok.
meaning para makakuan ka mo what will you use. Okay? Sige. What's your physical? So it should be part in your HPI. Diri adi at imo physical exam. Ang yung physical exam, what will you put there is your pwede ng mga vital signs, sa mga pertinent PE findings. Ini weight loss and weakness, presence of lightheadedness, polyuria and nocturia, ada ito niya hakuan. Ada ito niya ano ka pa? Imo history. Anit lump on the side of his
Okay.
lower back, left or right?
Left dok.
Both?
O sala dok. Left,
Hay nga side. Left or
left
right?
side la dok.
Oh, so put
Left side lang po dok.
lump. Lamp. Do you use lamp? Imo physical exam?
Mas.
Mass? Diba mass? Was
Yes,
it
Doc.
tender?
Sorry.
Non-tender? Movable? Non-movable?
Tender.
Tender po yun, Doc.
Is it movable? Non-movable?
Non-movable po.
Sige. So, amo ito ni mo physical exam ha. Mass on the left lower back, tapos non-movable, tender on palpation.
Noted, Doc.
Sige. Ano pa ni mo kuan?
Next slide.
So, what did you
So, for the
consider? Ano man na niyo pivot ito?
kuan, Doc, an iya pelvic pain.
It pivot kasi
Hello, Doc.
meaning, pivot kasi it meaning hiton, ada ka mo nagkukan kung ano nga diseases are you considering?
Yes, Doc. An aman, Doc, pelvic pain, intense
So,
pelvic
pelvic
pain.
pain. Tas,
Yes po.
pwede kasi ton also, diri usat iyo pivot para to decrease iton imo mga diseases. Pwede ka mo magduha. Like, pelvic pain and fever, pelvic pain and, naglalawin, pelvic pain and dysuria. So, dito, pwede ka magduha. Ha? It imo pivot.
Okay, Doc.
Para
Noted, Doc.
it iyo diseases nga ko considered na less na. Sige.
An interstitial cystitis we rule it in because the patient has intense pelvic pain, frequent urination, nocturia, smoking, tapos gintritia with gabapentin. And I cannot totally rule it out. And then cystitis because the patient experienced dysuria, frequent urination, I mean, need a small amount of urine, with pelvic pain. Tapos, we rule it out because the patient has no hematuria, urine. And the UTI, we rule it in because of the frequent urination and dysuria. We rule it out because there's no hematuria, upper back pain, nausea, and fever. And adi, Doc, gin-adgyap naman malnutrition.
Hindi naman yung kung malnutrition. Pwede lugod it iyo diagnosis. So, may daka, for example, magbutang ka ng UTI, malnutrition. Para hindi naman hiya ko.
Sorry, Doc, ang
Hiya ay
malnutrition.
Oo. Sige.
For our Doc, initial diagnosis, interstitial cystitis. Pero direct
You have to support that. Kay interstitial cystitis, that is more on laboratory.
Yes, Doc.
Diagnostic, di
Asya
ba?
nga ni.
So, important talaga niyo heads. Kay you should ask contextual history. Kay you might never know nga you are dealing pala with mga STI.
STI.
Tas it's also part ito imo education, ito imo patient, na regarding mga safe sex, lubricants, if they cannot pwede condoms, so dito. Pero dili ka pwede nga, ayaw ito. So, you give options. Imo,
Okay, Doc.
Dapat kasi open mind na kita yan na.
Oo. Na ano lang kami to, Doc, kay bagat feeling naman may sexual na.
Oo. So,
Pero
kung sugan nga
anyways,
nito, you can ask the mother na, anyway, dako naman ito niya, pwede man niya nga nakahigdala. You can ask the mother na kung pwede kami anay. Tapos, before you do heads, kailangan mag-ask ka gyapon ng consent ng patient. Ha? Kung
okay, Doc.
privacy
Pwede nga
ba?
nito.
Tapos, oo, We can do that kasi when we do heads talaga, especially kung may mga sexual kuan na, you can ask the mother nga, ma'am, may da kasi kami istorya nga, pwede kami laan yung mag-istorya, so hindi may dala ko ipapakian ha iya. Pero don't worry, kung ano man tama may istoryahan, so dito, so dito. Tapos, before you go with the patient, you should ask nga, may dala ko ipapakian ha imo. Ayaw ka baraka, dire ko niya i-disclose, dire ko niya yayakan na yung nanay. But kung may makita ako nga may problem nga kuan, for example, kuan na imo health, ha imo safety, may dako bangin isus kailangan mo ko isuman. So amo kasi ito niya.
Noted, Doc.
Okay.
Thank you, Doc.
Okay.
Doc.
Sige. So, in doing history, it's not easy. Parang it's not in a click mag-aram ka mo dayon. So, it takes time, skills, and so there are some nga even nag-resident ako ha, EVRMC 2006. 2006. So, there is some history pa talaga nga, there is some nga I miss. Ano ito nga nahiling? I hope you learn something. So, it's okay nga damo at least damo nga patient nga that you've encountered. At least kamo you've seen your patient na last ko nga nakaptan hira. Kausala kami last year ba? Kausala ra nagkaputing pasyente. So, imagine now nga pagkadto nira EVRMC or ha ibang mga hospitals, masyashock ka talaga on how will you handle ito imong history. Labi na kamo pero clerk yan na, diri na 24 hours na ba kamo? Diri na da kamo na 24 hours ano?
16 hours daw, Doc.
Oo, hayahay ng buhay. Kasi kami hadto, we are the lowest of the lowest. Natanan nasugo amon, pati IW ginsusugo kami. 24 hours kami pa to nagpupushan wheelchair para lang ma-x-ray ang pasyente. Ganun. So, it's okay, but as you go along the way, you will learn how to do ano history, how to filter imo mga there are some parents kasi that they will give you all the information, even the problems hit ira family. Ako nga nila kakulop an akong secretary na hiling na lang ako kay maihan pasyente kay pati nira problema ni ira pamilya. Nagsusumad ako. So, you learn how to filter gihapon timong history tapos you always remember that as a doctor, you should know better. There are some information na di rin mo kailangan isurat time HPI. Ha? Okay? So, next week, kung ka mo, history taking. So, you will do history taking again. So, medyo busy ako. Medyo busy gihapon ako, so I won't be able to see you at EVMC. So we will do, pag next session, we will have a quiz. Quiz la. Just a 15 questions la. Basic, laya kanan history and physical examination, ha? Okay, so,
Okay, Doc.
ano nahinan ito ni team leader?
Bani, Doc. I'm here, Doc.
Okay.
Mas screen
So,
screenshot.
sige, okay. Okay, sige.
Dilan pag ano po? 1, 2, 3. Okay na po.
Okay, sige. I'll see you next.
Excuse me, Doc.
Okay, ano?
May last ngayon na pakiano, Doc. Is it okay, Doc, na kung baga, very good, klaro na gina-interview with patient, Doc ba? Pwede kami mag-change in patient?
Oo, pero sito that at the start pala, kumbaga kuan you can ask Dr. Ramirin kung pwede kang mag-change. Kung diriya ang cooperative or di kaya itiyo SO gihapon and cooperative. Ayo pag hinulata nga magmaiha ka mo kay maiiha ka mo pasyente. Pwede ka mo mag-ask kan doktora. Okay, I've also experienced man gihapon mga suga dito. Nag-change, papa-change ko din pasyente.
Okay po, Doc.
Okay,
Thank you, Doc.
sige. Thank you.
Thank you, Doc.
Thank you, Doc. Thank you, Doc. Hi, sana all Carmela Doc ulit ako. I love Doc.
I love it.